Carol Vance. I am the CEO and founder of Alinea Engage, and I'm lucky enough to be back here today with Dr. Lynn Steffes, physical therapist, to talk about a topic I know my friends are constantly approaching me about. They know I work with physical therapists, and they have no idea, for the most part, that even though virtually every state is direct access, that they have direct access to just pick up the phone and make an appointment with their physical therapist. They push off making that appointment because they think they have to see their primary care physician or an orthopedist first. And the truth is, they pick up the phone, call massage, call chiropractor. They could be seeing the physical therapist earlier and more often. Right, Lynn?
It's probably one of my biggest pet peeves is
Yes.
the whole idea that people don't understand that they can come directly to a physical therapist. So I want to share with you some things about direct access and also give you really kind of what I call the 7 steps to summiting direct access.
Yeah.
Kind of like what you should do, what you put in place to encourage and expand on those consumers that seek your services, direct access. I think this is something everybody should put in place, regardless of setting, private practice, hospital, clinic, whatever, but super important. So I'm a huge proponent of direct access and was involved at a state level rewriting the laws in Wisconsin over a decade ago.
Really?
And so, yeah, I was there when the governor signed off on it.
Good idea, Lynn.
That's pretty cool. So I want to share with you what some of the underlying barriers are, though, to direct access. And I want to first share that I have the opportunity to teach at a number of universities, and I teach at Marquette University in Milwaukee. So for the last 5 years in our PT6 program, one of the first things I have the students do is I actually have them go out and do consumer surveying.
Oh.
So I have them, the PT students, surveying consumers that are non-PT. I allow them, they have to survey 5 consumers each. 2 can be on the campus and the other 3 have to be off campus. And I have them ask certain questions. And a lot of the questions are related to direct access. There's a whole bunch of other ones, but it gives them a little bit of a sense of what consumer perception is. And they always come back they're a little bit worked up about the results. They're a little bit surprised. But I want to talk specifically on what they find on direct access today. So one of the questions I have them ask is, can you seek services of a physical therapist without seeing a physician first? And then if their response is yes, or their response is no, so the response is yes, would you? Is the second question. If the response is no, why wouldn't you? And I feel like the trend has been changing over the past number of years. A lot of consumers seem to say yes to the first question. They do know that they could seek a physical therapist without necessarily seeing a doctor first. So that's good news. That awareness is good. But the second part of that question is actually what really is tough. And I want to give you ideas on how to overcome that. So the number one reason they believe they can't see a physical therapist first is that insurance would not cover their therapy.
Oh, without the referral in their mind.
And what they don't know is there are so many third-party payers who actually do cover physical therapy directly without a physician's referral. So they often assume that it won't get paid for. Now, even Medicare covers at least the evaluation portion of the physical therapy without a referral. Then a physician has to demonstrate involvement in the care by signing off on a plan of care. Similarly, Medicaid and work comp, but many of our largest commercial insurance plans cover physical therapy without any need for referral. And yet consumers' perception is they don't. And maybe even worse than that, a lot of providers actually don't know that insurance companies cover. So I'm going to give you some tips on that.
Okay, great.
But I want to tell you another barrier. And this is the barrier that probably bothers me more than anything. Many consumers don't come directly to a physical therapist because they say they need to see the doctor first to determine what's wrong or to be given a diagnosis. So the physical therapist knows what to do. So in other words, they don't understand that physical therapists do diagnosis.
Right.
And I feel like physical therapists, I think we've done a really good job of selling the public and consumers that we know how to treat them. I'm not sure we've done as good a job talking about what our capabilities are in the diagnostics area.
For sure. I hear that pushback all the time that my PT, APT can help me get better, but they can't figure out what's wrong. Well, it's not even logical.
Even physicians sometimes, I have a number of physicians that I work with and discuss these issues with, and a lot of them will even say, when the patient comes to me, I'll tell them this is what I think is wrong. Patients want an image, an x-ray, a blood test, something like that. So I feel like patients need to be educated about what I would term and what the PT profession calls differential diagnosis.
Okay.
And so there are a couple ways we can do that. One is simply by narrating our evaluations. As we're evaluating a patient, as we're reviewing their medical history, talking to them about those red flags or conditions or diseases that they're kind of worried we're going to miss.
Yep.
Cancer, for example. People worry you're going to miss some major disease. Physical therapists are trained in differential diagnosis and the ability to look for red flags, similar to physicians. So, and if we were to start treating someone and they didn't respond to physical therapy, we would actually be spending a fair amount of time in fairly close proximity, maybe 2 or 3 times a week, seeing that patient, and would definitely be able to refer them on for more testing. So I don't think physical therapists miss things that are super important any more often than a traditional physician. And in fact, they get to spend a lot of time with their patients.
Right.
So we often pick up on things. So that's one thing I wanted to talk about, but I really wanted to give like 7 steps on how to set up direct access and how to really promote it. We can't just have it like, oh, it's the law. Not too many people sit down and read the law. I'm sorry. We've got to really start selling it. So I want to kind of start with the basics. So first of all, regardless of where you are, study your individual state's direct access laws and often the administrative rules that go along with it so that you understand legally where you stand. If you feel like that's overwhelming, contact your state association and ask them to explain what your direct access rules and laws are.
In layman's terms, so you can explain it to your patients.
Correct. And then make sure that you develop policies that maximize them. Too often people will say, well, I'm not sure how this is, so I'm just going to get a referral or an order. Or I'm not sure, how this applies. I'm just going to get, no. Learn the laws and maximize the laws. That's how we're going to grow professionally. Second of all, study your top 5 third-party payers. So of course, in a given practice, they might have 15 different insurance companies, Medicare, Medicaid, work comp that they work with.
Okay.
So Medicare, Medicaid, work comp, VA are kind of in one bucket and they have consistent rules. But if you were to say, okay, I have Blue Cross Blue Shield, I have United Healthcare, I have Aetna, Cigna, study the specific insurance rules and find out what their policies are overall. Document those and have those available for whoever does intake and make sure, again, you're maximizing those. I really believe that we need to script our entire team on direct access policy application. So first you need to script the people who answer the phone. When a patient calls in, and I do a lot of mystery shopping in my role as a consultant, I'll know that a particular practice has direct access. I'll know that the state laws allow direct access. I'll even know the insurance company that I'm using in my mystery call pays for direct access. And I'll call in and I'll ask, I'll say, can I come in directly? And the receptionist will say, you need to see a doctor first. So somebody's not connecting the dots.
Got it. So if you had a cheat sheet for your top payers for their reimbursement of direct access, right there available, you know what the insurance company is the patient has. That's an opportunity to not only inform, but to let them know that for the future, that they can come back and be paid by their insurance with direct access.
Right, and I think too often...
It's a huge opportunity.
We just say direct access. Well, then the receptionist hears about one patient whose claim wasn't paid for whatever reason, and they we're nervous, we don't want to do it. Yeah. No, everybody on the same page. Written policies and procedures, written scripts. Everybody has to get it. That's how you maximize it. So that's step 3. Step 4 is create a simple direct access written message. Post it on your website. Put it in your consumer collaterals, your brochures, etc.
So
Publish
important.
it in a patient welcome packet. Send it out in your follow-up email reminders after discharge. So a lot of times we stay in touch with our patients. We've got to kind of remind them about direct access. I know with Alinea
Yes.
that you have an opportunity to do that as well.
Just made a note to that effect that
Yeah.
we need to broadcast that message.
Yeah, I think we have to kind of remind people, even if you came from the doctor the first time in this state with your third-party payer, with this provider, you can come back directly.
What a great message to tell your friends and family, too.
Yeah, absolutely. So that's actually part of the next step 5. Every single time your practice calls to verify benefits. So say a new patient comes in and they have a new insurance company or a plan. You call to verify benefits.
Right.
I don't care if they have a doctor's order or they don't. Every single time you call to verify benefits or you go online to verify benefits, find out if a referral is needed. Find out if they say a referral is needed on the phone, ask them to send you a reference to the policy. Sometimes they say something that's not even actually true. And then what we want to do is make a note of that. And when that patient comes in, both the person doing the intake, the receptionist, and the therapist should message that. Not only at the first visit, but subsequently when they're getting ready to finish their episode of care. You should say, this time Dr. Smith sent you. However, if you need to come back in the future, I wanted to let you know that your insurance company does not require you to see the physician first. And by the way, if your family's on the same plan, your family can come directly. And by the way, if the people you work with are on the same benefit plan that you're on, you could also let them know. So make the patient an evangelist for direct access.
Huge. I have a question.
Yeah.
Is it per insurance company or is it per diagnosis, again, within that insurance company,
No,
or it's just one policy for any
It's generally
diagnosis?
the insurance company. It can be plan specific. So I do want to give a little caveat here. That's a really good question. So say you have a United Healthcare plan, and United Healthcare pretty much universally respects the direct access laws and rules in a state. So they do pay for direct access.
That's good.
However, United Healthcare, if they're contracted through a national union organization, such as United Steamfitters, United Carpenters, United Auto Workers, those United plans may have a separate policy that requires referral. Something we certainly are fighting an uphill battle against. But so that's why calling and verifying the benefits and getting that information each time can be so powerful.
Keeps your information fresh too.
Right.
Yeah.
And it allows you to tell your patient, hey, I went to this degree to find out this information for you. So we want to let them know that regardless if they come through their doctor or if they come on their own, we still will work with their healthcare team.
Big message.
And so, big message. Direct access doesn't mean we're like a little silo clinic.
Right.
We are still part of the healthcare team. What direct access means is you can come here as a first step. You don't need to wait on that physician visit. You can get started.
I
And
think
that's
PTs really have to realize that that can be the difference between having a patient or not,
Right.
or having a patient earlier, the first sign of symptoms or not. This is huge, Lynn. This is a game changer.
It's such a big deal. And so my number 7, number 7 is reference your training, reference your evidence, and restate during the assessment that you're looking for other things so that patient walks away with confidence, not only that they can come because you can help them and that the insurance will pay, but that you are going to be a thoughtful practitioner that screens for other things. And so 1 is know your laws and rules. 2 is study your top 5 payers. 3 is really get your whole team on board. Focus on what they're going to say, give them the tools. Number 4 is create that direct access message and put it out there so consumers can see it consistently. 5 is be hardcore when you're verifying benefits. Get the information and then share it. And then 6 is create that strong narrative approach. And then 7 is on their way out the door, remind them that you look for everything, remind them that they can come back to you. I think direct access is an incredible opportunity. I think it's important for us, but heck, I think it's even more important for consumers to have that option to come directly get great diagnostics, great hands-on care, and actually, in the end, save money. They don't have to see the doctor. They don't have to go for imaging. Now, if a PT sees them and sees something else, they'll refer.
I love it. PT has the opportunity to change our healthcare system, both outcomes and costs. Let's use this direct access.
Yeah, absolutely. But don't let it just happen.
Make it happen.
Follow the steps.
Yep.
Make it happen. Be strategic.
Thanks, Lynn. Once again, you've given us great feedback and tips.